Hey, welcome back to Inside. I'm Rachel. We're here again with Heather from Foster Financial, and we're chatting all about some legislation changes recently. I know there's been quite a lot of those over the past few weeks and months and over the years.
Yeah, so the one that I wanted to talk about today, which kind of affects retirees, I'll actually tell you this, that one of the common things that I hear in my office, when you sit down with somebody and you say, hey, when do you want to retire? I hear this all the time. Well, I would like to retire at 62, but I feel like I have to work till 65 because healthcare is so expensive. So they feel like they have to work till 65 to get on Medicare. And they think there's really not a lot of options prior to that. And that was kind of true. When the Affordable Health Care Act was created, it was not affordable for most people, okay? These premiums are ridiculously expensive, and honestly, the coverage was really bad. High deductible plans, very expensive, unless you qualified for a subsidy. So if you fell under the subsidy planning, then you could actually afford the plan. The premiums would be subsidized by the government if you made under a certain amount of money. There was a cliff, so there's something called a subsidy cliff that we've been dealing with since they created the Affordable Health Care Act that says if you made $1 over the amount that they allow, then you get no subsidy at all. So the difference between going $1 could cost somebody $10,000 or $15,000 in a year if they went over that cliff. Well, during COVID, they came out with a plan, basically under the American Rescue Plan, that said, hey, for a while here, we're going to do away with this whole cliff thing, and we're actually going to say that you can actually phase into getting the subsidy based on your income as a percentage. So for the last 2 years, we haven't had to deal with this cliff situation, where it's, hey, if you make $1 over $68,000, you lose all subsidy, which has been really nice for advisors because we're like, hey, you can retire prior to 65 as long as we get you a subsidy. The health insurance won't cost you an arm and a leg. So up until recently, though, in September, actually, when the president signed it into office under the Inflation Reduction Act, so they call it the IRA Act, but it's the Inflation Reduction Act, which goes over a lot of different things. They added back in an extension to the current code that says, hey, instead of it being a subsidy cliff, that if you make $1 too much, you're going to get no subsidy at all, it's a phase-in or percentage of your income. So basically, the maximum is about 8.5% of your income on the going towards the lowest plan on the ACA, or the Affordable Health Care Act. So there's no cliff. We've got the cliff removed until 2025. Now, if they don't make any changes, it would sunset and we would be back to a cliff situation where if you go $1 over, you lose all subsidies back in 2026, but hopefully they'll extend that again. But this extension is really huge. So if you are, thinking about retiring and that was one of your concerns is, hey, I don't want to retire at 63 or 64 because I need that health coverage, and I've heard how expensive it is. With that cliff being removed, we can get people really great subsidies and allow them to, kind of retire without having to spend $1,500 a month per person for really bad insurance. The government's going to subsidize that for you. So it's a good way we can do calculations for people to kind of show them what that subsidy would be, but the cliff is gone. So if you make $1 more than what the cliff used to be, not a big deal. It really doesn't affect you. You can make hundreds of thousands of dollars a year, in fact, and still get a subsidy or a subsidized plan through the government. So that was a big change that was went through the House, went through the Senate, and then the president signed it into an executive order back in September. So big changes. If you're not aware of it, that the cliff is currently gone, or you feel like, hey, I can't retire, or you've been trying to control your income so that you don't fall off that cliff and lose the whole entire subsidy, we've got more options now.
Oh, there's so many options out there that I think people just don't even know about, and so you guys are the great place to start there. So thank you, Heather. Once again, of course, if you have any financial questions, call the number on your screen for a complimentary consultation today.